I started working here, my position at United Way, just a few months before the pandemic, before everything closed down. And so I think for me personally, my anxiety increased quite a bit when we started to close things down, and really wasn't fully aware of what my role might be in some of the response that we had around the pandemic. And then you fast forward to everything around racial unrest this last summer, the derecho. It seemed like there were things that just continued to compound one after the other. And I think any of the issues that we had, again, just your anxiety might have just started to ratchet up with each instance of something else happening over the last year. And I don't think I am unique in that. I know that there are a lot of professionals who have struggled with that. I do think that mental health and the workplace are intertwined, because if you don't have a good day, right? Like if you're in a poor mental health space, your communication with your coworkers and your peers aren't going to be as strong. I think, again, there's a lot of the emotions in there, and you're not typically presenting your best face to your coworkers. I think also as employers, we have, I think really we should be creating safe spaces for employees to feel like, hey, it's okay if you're not having a great day, and creating those avenues for communication and building those relationships, either again with your peers or your supervisors, and just, feeling like you can be honest about your mental health that day, and just saying, you know what, I'm not sure that I'm going to be as productive as I might want to be. And then having the leadership of the organization be okay with you taking a mental health day or taking a break if that's the case. And there is a traumatic event around the pandemic or the derecho, there's a lot of conversation about it, and then we sort of forget about it. Around the derecho, working here in volunteer engagement, we were expected to help mobilize volunteers both locally and nationally, which we did, but it was difficult because we were all, most of us had our own homes and our own families to take care of while we're also trying to take care of the community. So there were 2 weeks where I worked 80 plus hours a week. And then of course you would go home and you wouldn't have any electricity, and still trying to keep your own family united. I had a few instances where I essentially had an emotional breakdown and was just very tearful and wanting to throw in the towel, really. So I have always encouraged people to seek professional assistance if that's the case, if they feel like they're getting to a point where their typical coping skills just aren't addressing their needs or, getting them to a good space. And so I have been very vocal in advocating for mental health care from a lot of different perspectives. But, everything that happened in this last year, I think it's gone from, something that was maybe a minor thing in my life to more prominent. And I think just because of how challenging this last year has been, we just have to remember that our own feelings are valid and we are important and we should be taking care of ourselves.